Hi guys, today I'm going to break down any of the old school thoughts that you probably have about iodine consumption. I'm going to tell you all about why we need iodine, the negative effects of too little and also too much iodine, and what is the optimal dose. So first of all, iodine is a trace element and has one very important job to do in the body, which is to synthesize thyroid hormones. So in order to create T4 and T3, which are two of your thyroid hormones, you do need a combination of the amino acid tyrosine and iodine. So iodine deficiency is actually one of the most common causes of hypothyroidism, which is an underactive thyroid. And most people think that you should consume a ton of iodine in order to reverse this. However, consuming too much iodine is actually a whole nother issue. So if you want to make sure that you're getting just the right amount of iodine. Not too much, not too little. So too much iodine is also associated with hypothyroidism. So excessive iodine intake can also cause thyroid autoimmunity, meaning that someone can develop antibodies that will attack the thyroid gland, causing an autoimmune disease such as Hashimoto's, which is actually what I have. So let me explain how this damage to the thyroid actually occurs. So when the iodine is processed within the thyroid gland, hydrogen peroxide is actually released, which is a free radical. Basically, free radicals cause damage in the body. Luckily, we have selenium, which is another trace mineral, which can come and neutralize the free radical. So it will stop it from doing any damage. However, this only happens if there's enough selenium to do that job. So you can actually go watch a previous video that I made to learn all about selenium. So if you have excess iodine from food and from supplements, then the production of free radicals can damage the thyroid tissue directly. And the thyroid cells will then release something called DAMPs, which are danger-associated molecular patterns, and this can trigger the autoimmune process. So by consuming so much iodine or too much iodine, you could potentially be causing thyroid cell destruction. Excessive iodine intake creating and increasing thyroid antibodies has been the result of many different scientific studies. I'm going to go through a few examples just to make a clear point here. So there was a 2003 study which was conducted on 45 patients who had hypothyroidism as a result of Hashimoto's. Group 1 was placed on an iodine-restricted diet of less than 100 micrograms per day, while Group 2 was not. After 3 months, Group 1 had a 78.3% of the group return to a euthyroid state, meaning that a normal functioning thyroid, just by restricting iodine intake, while Group 2 only had a 45% of the patients experience this improvement. Another study looked at a population of 302 school children in a town in Greece that had previously been iodine deficient. And the findings were compared to a similar study conducted 7 years prior in that same area. And the data comparison showed a 3-fold increase occurred in these school children in regards to a prevalence and autoimmunity of the thyroid. So since an elimination of the iodine deficiency in this area, an increase of the prevalence of autoimmune thyroiditis occurred. And then a similar study was done in Turkey. This was on 1,733 adolescents, and 2 regions of Turkey were looked at after 2 years of iodization, and the results showed that iodine supplementation did obviously eliminate the iodine deficiency portion in the Black Sea region, but this also increased the prevalence of autoimmune thyroiditis and thyroid dysfunction. So again, those are just a few studies that have been done to show you what happens when you're consuming too much iodine. Global Health Organization started adding iodine to salt and other fortified foods because at one point most of the world was iodine deficient, so that's kind of how that evolved. However, after achieving their goal of eliminating iodine deficiency, the World Health Organization realized that too much iodine can trigger thyroid disease. So how much iodine are you actually supposed to consume, and where does it come from in your diet? The recommended daily allowance for iodine intake is 150 micrograms, mcg. for non-pregnant adults, and then pregnant adults are recommended to take a higher dose of about 220 to 250 micrograms. And then breastfeeding women are encouraged to consume a little bit more at about 290 micrograms. The American Thyroid Association advises against the consumption of iodine and kelp supplements in an excess of 500 micrograms of iodine daily. And the absolute most tolerable upper limit would be 1,100 micrograms of iodine per day. But after I just explained the harm that iodine can do to the thyroid, you definitely want to reconsider ever even taking that much. Doses as low as around 300 micrograms can exacerbate autoimmune diseases and thyroid dysfunction. The issue is that it is extremely difficult to tell how much iodine you're consuming daily. If you consume iodized salt, that is obviously one source of iodine. Foods high in iodine also include kelp, seaweed, spirulina, chlorella, fish like cod and tuna, shellfish like shrimp, egg yolks, dairy, bread, and a lot of commercial baked goods because of all the iodized salt and things that they're putting in there. So if you have done lab testing to look at your iodine levels and they're proven to be low, then you may want to look at your diet first. So if you decide to supplement with iodine and not change your diet, consider taking doses on the lower end of the spectrum, around 100 to 200 micrograms per day, or even less for a short period of time to normalize your levels. Eventually, you will want to reduce the amount of the iodine you're supplementing with, or just adjust your diet accordingly. But if you have done lab testing and your iodine levels are too high, or you have Hashimoto's thyroiditis or suspect that your iodine levels are high, you could consider starting on an iodine restricted diet for about 2 to 3 months at less than 100 micrograms of iodine per day, and then examine and adjust your diet to normalize the consumption of iodine to the recommended daily allowance. So one other recommendation is to supplement with selenium in order to balance out any damage done to the thyroid from excess iodine intake. Of course, always speak to your doctor before making any of these kinds of changes. This definitely isn't any medical advice. Just my thoughts and all of the research that I've done on these supplements and minerals. So I'm curious, what are your thoughts on iodine? Are you caught in that old school thought about this mineral, or were you already aware of the potential dangers of excess supplementation? Leave me a comment. I'd love to hear from you, and I want to see if you enjoyed this video. Thanks.